Well, thank you, Mr. Yoho, and thank you, Mr. Speaker. Mr. Yoho, we appreciate you leading the special order tonight to talk about this issue. It's an issue important to the entire country and all hardworking taxpayers of America. 1.4 million people were kicked off their plans and forced to purchase different insurance plans. We saw 45 to 55% premium increases in my home state of Illinois in 2017. Deductibles have increased 64% nationwide. 31 million people can't afford to use the insurance they have because their deductibles are so unaffordable and high. 1/3 of the nation only has the option of one insurance provider on the $2 billion websites that we know as the Obamacare exchanges. A monopoly that drives up costs, and 75% of people in my home state of Illinois have one or at most two providers. 1 in 4 people in Illinois are on Medicaid. That is unsustainable for a state with an $8 billion budget deficit. These statistics telling us Obamacare is collapsing, and if we do nothing, we will be leaving millions of Americans without any option for health care coverage. But we're not offering this alternative because of statistics. We're doing it for Rich and Sandy in Pana, Illinois, whose deductibles went from $300 to $2,000 per person for less coverage. We're doing it for Janet from Edwardsville, whose family plan was considered a Cadillac plan and was replaced with a plan that had a $6,000 deductible. And we're doing it for Lynn, a farmer in Springfield, Illinois, who provides insurance for her barn manager, but the best she could find after Obamacare was one with a premium that increased by more than $100 and increased her out-of-pocket expenses by another $1,000. This is our one shot to fix our failing healthcare system for the constituents I just mentioned and the millions more across the U.S. who have had the same thing happen to them. And this is a pretty good bill to start with. After 4 years of watching premiums more than double, deductibles skyrocket, and choices dwindle for my constituents under Obamacare, I am proud to be part of a responsible healthcare solution to lower costs and increase options for individuals and families. The American Health Care Act may not be the exact bill we would have written to reform our healthcare delivery system prior to Obamacare, but we can't go back in time. We have to face reality, and the reality is we have states like Illinois who chose to expand Medicaid, and we can't abruptly rip coverage away from them like Obamacare did for 1.4 million Americans. In addition to protecting people with pre-existing conditions and allowing young adults under the age of 26 to remain on their parents' insurance, those who currently qualified for Medicaid will remain covered until their economic situation improves. Our goal should be to ensure that every single person who wants a career, a good-paying job, and wants to get off of Medicaid should be our priority. But when their situation does improve, which is, again, what all of us should hope for, then we help them with monthly, portable, age, and income-based tax credits that will go directly toward paying their health insurance. These also help those who were left behind by Obamacare, middle-class Americans who were forced to buy insurance with costly premiums and deductibles, but did not qualify for subsidies. This is just the first part of our plan, which can be done through the budget reconciliation process. Next is making changes to lower the overall cost of health care so these tax credits go further for every American. We have one chance to fix this for the American people because Obamacare is collapsing. And I urge all of my colleagues to support this plan. And I want to say thank you again to my colleague, Mr. Yoho, for leading this effort tonight, and I yield back the balance of my time.